HealthWise Alternatives with Jackie Bell, promoting good health through information and education.
Welcome to HealthWise Alternatives. I'm your host, Jackie Bell. Tonight we are bringing you information about breast health, and hopefully enough information about holistic breast health to give you an idea of what women in the Commonwealth are doing naturally to stay healthy. Tonight our guest is Dawna Jones. Dr. Jones is a board-certified obstetrician and gynecologist and a fellow of the American College of Obstetrics and Gynecology. She has been in practice in the Boston area for the past 21 years. She lectures on women's health and natural approaches to maintaining health and is certified in homeopathy, which she incorporates in her medical practice. Dr. Jones' unique practice of holistic and traditional medicine has established her as one of the most promising experts in the Boston area. She is currently on staff at the Jordan Hospital in Plymouth, Massachusetts, and sees patients at Pilgrim Shores OB/GYN in Midwifery in Duxbury, Massachusetts, or privately for holistic consultations. First, I just wanted to mention that the statistic about breast cancer, to start out with a little bit about that, and how 1 out of 8 women are expected to get breast cancer. And we see a drive with the pink ribbon and breast cancer awareness, but yet in holistic medicine, that's not how we approach breast disease. We look at breast health. Can you explain a little bit about your practice and how you approach breast health?
Right. Well, there are a few things in our practice that are very different. I have been trained classically as an obstetrician gynecologist. I trained here at Tufts, and then I went to homeopathy school. So I think that the way that we look at a patient is very different. We're looking at the whole person. We're not looking at the person in segments or trying to do something for the heart or something for the gynecological portion of the patient. You really have to look at the total symptomatology of the patient or the totality of the symptoms. With our patients, many times when they come in, I sit with them and talk to them a little bit about their lifestyle. We talk about their nutrition and diet, and I'm looking at areas which we can improve a little bit to help the person have their own capability of keeping their body in balance, particularly hormonally imbalanced, and empowering them for their own health. And so I think that that is a very different approach. In a traditional practice, before I went to homeopathy school, when patients came in, I found that I was treating symptoms all the time. People would come in with a vaginal infection, and you're running after this vaginal infection, trying to figure out what it is and fit them in a category and give them an antibiotic or an antifungal, and they come back with the same thing the next month. And what we try and do in our practice is really teach someone how to keep themselves healthy enough so that they're not coming in with those symptoms. So when you're looking at breast health, we're trying to find out, first of all, what kinds of things can they do in their own lifestyle to change. Are they taking vitamins? Are they eating a diet properly? Are they getting nutrients from that diet that are going to help them to repair their body? And in many of our patients, as they get older, you will find that there are subtle changes in the 40s, 50s, and 60s in those women, some of them having to do with hormonal changes, some of them having to do with exposures that they have in their own life or even a family history that we can have a positive impact on. And so that they are actually taking control rather than waiting for something to happen.
Yeah, and that's really the best approach. The American Cancer Society strongly feels that breast cancer is not preventative, and yet there are so many risk factors that we could name and discuss that we can take control of. For instance, the amount of pollutants that we're exposed to, also chemicals, whether they're long-term pharmaceutical or recreational. Smoking is pretty basic. There's also the hormones that we get too many of in our food and so forth. I'd like you to talk a little bit about hormone therapy and how you approach that and how it can affect our breast health also the immune system, the role the immune system plays and how you approach the immune system. And then a little bit about nutrition would be really helpful for our listeners.
Okay. Well, those are quite a few things to cover, so why don't we start from the beginning?
Okay.
I mean, there are certain risk factors that are scientifically accepted as being risk factors for cancer. One of them is age. As we get older, you're more at risk for developing breast cancer. But the statistics that you quote are more of a lifetime risk. And we find that as women get older, certainly past 50, that there seems to be a higher incidence. That can be for a number of different reasons. As you spoke of, and we're going to talk about, there may have been a cumulative exposure to radiation, pesticides. They've gone through a whole life of estrogens, and how does that impact? Other factors that are scientifically thought to be reasons, one of them are genetics. We don't have too much of a impact on how we're born or who we're born from, but that is really a small percentage of patients who have a genetic mutation that would make them susceptible to breast and possible ovarian cancer. Women get breast cancer more than men, so that seems to be another risk factor. Our accumulation, our lifetime of exposures to radiation is another one. It isn't a one-shot deal. It is radiation, and then you get exposed again and again, and all of those are cumulative. And that can cause DNA damage to the cells, and a breast cell that is susceptible to other changes may turn into a tumor or a cancer. There are also exposures that aren't as highly accepted. I don't think that we have still owned up to the exposures of contaminants in our food. I'm talking about pesticides, talking about organochlorines, which would be more like plastics or chlorinated water. We get exposure through tampons with bleached paper, paper cups, styrofoam. All of these are in our groundwater. We're getting exposure through that. If you're someone who eats meat and the meat has been, I shouldn't say contaminated with hormones, but if the cows have been given hormones or they've eaten grass that has been treated with pesticides, that all sits in the fat in the meat. It also comes out in milk or eggs, dairy products from animals that have been exposed to those. And in fact, it's funny, they recently did a survey in the USA and Canada, and they collected fat and milk from women and found that there were traces of chemicals and pesticides that have been banned in this country for 30 years, like DDT. Still traces of that in the breast, in the fat tissue. Wow. And those can sit there and cause damage to the DNA.
There was a doctor I studied under, his name is Dietrich Klinghardt. He's a medical doctor in the West Coast. And his cancer patients who had tumors removed, he asked if he could analyze the tumors, and in every single one he found mercury.
Yeah, that's interesting. I would also think that there's a possibility that the mercury could have a negative impact on the immune system. And your body's immune system is constantly sweeping away dead cells, cancerous cells every day. So if your immune system is preoccupied with cigarette smoke and pesticides and poor diet and things you can control, instead of focusing on what it's really supposed to be doing, so I think that would be a problem.
That's
as well.
part of the education that you do then when people come in, is basically just set the groundwork for foods to avoid or foods to start eating.
Yeah, I really think about it as foods that you want to incorporate into your body, because there are certain foods that will help you to neutralize radiation that you've been exposed to, or chemicals that you've been exposed to,
so what would be an
or
example
estrogen.
that you...
Well, for example, increasing fiber in your diet will actually have a positive impact on how you metabolize estrogen. There are also foods that are very protective. The foods from the broccoli and cabbage family, broccoli, cabbage, bok choy, Brussels sprouts, all contain a ingredient known as DIM. What it does is it helps you to metabolize estrogen, and it will actually neutralize excess estrogen. Say, for example, you were exposed to a pesticide. Pesticides in our body are seen as estrogens. These are estrogens that are not supposed to be there. They're called xenoestrogens. So they sit in the fat. In women, you have a lot of fat in your breast tissue. And so that's where it's going to sit. You can do things to neutralize that, to get it out of your system. It's also thought that if you're eating these foods every day, there can be some protection against breast cancer. If you're eating foods that have seaweed, there are certain seaweeds that will neutralize radiation. And so we have people incorporate that. I usually eat kelp in my food. The iodine will help with your thyroid, which also has an impact on your metabolism and works with your adrenals to help your immune system stay healthy.
I think that's pretty well documented in Japan as well.
Right.
Yeah.
And so that was one of the things that impacted on them after they had their radiation exposure in the 40s that helped them to be a healthier nation.
So what about the immune system, like latent chronic viruses that people have, like you're talking about the repetitive infections and so forth? How does that weaken the immune system or play a role in your risk factors for breast cancer?
Okay. Well, there are a number of different ways that your immune system can be weakened. Generally, you have a healing energy or a vital force known as your chi, and that can be impacted on by a number of different factors, including mental, emotional factors. A virus can be one of the environmental factors that would impact on your body negatively. Your body has a complex system to kind of sweep away all impurities, and your body will go into this hyper mode. You have surveillance in your bloodstream. You have certain cells that are actually surveillance cells, so to speak, and T killer cells. You have a number of different stop points in your immune system, such as your thymus, your spleen, your tonsils, all the lymph nodes, and the lymph system. And there are two organs in particular, one organ that sits on top of your kidneys on both sides called the adrenal glands. They have a large impact on your immune system. In our society today, many of us are under a lot of stress. It's mental, emotional stress for the most part. And the adrenals produce a hormone called cortisol that has a direct impact on your immune system, but it also helps with your ability to cope with stress. So if you are constantly under stress and constantly putting out this hormone, it will have a negative impact on your immune system, primarily because your adrenals will not be able to keep up just with the stress level. So you hear people talking about, I feel lousy, I'm under a lot of stress. This is the physiology of why you feel lousy. So the adrenals like certain vitamins. The B vitamins and C vitamins are key. You have to have those. It also likes magnesium and omega-3 fatty acids. And so if you're getting enough of those in your diet in a way that is useful to your body and bioavailable, not just taking vitamins, but getting in foods that have high levels of these vitamins and minerals, you're much more likely to help your immune system to be healthy. And so in that case, the breast is a part of the rest of the body. You have lymph nodes in the breast. Your surveillance system is working in your breast as well, and a healthy immune system is going to have a positive impact on the breast. One of the things that has been talked about or not talked about in Western medicine is just doing some manipulation of the breast itself, breast massage and skin brushing, which I know that you know quite a bit about.
And this is beyond the breast examination.
Right. This is something that we talk about with the patient, but...
Yeah, and in Europe, they, if you go for a massage, they massage the breast, they incorporate that, but here in the United States, you need to ask for that, and so what I tell my clients to do is actually massage their breasts every day, and I call it brushing and flossing your breasts in between checkups, and just to keep the pathways open for the lymphatic drainage and blood flow, and also nervous system circulation, and hormone communication between all the glands and the breast. Yeah, so that's a novelty. Let's talk a little bit about the controversy around mammograms. And because of, you mentioned already, the accumulation of radiation exposure is not healthy, and yet we need the way the medical community works is they want a earliest detection possible, so they're looking to take some kind of an image and the mammograms use radiation, and that's what the doctors prefer to see if there's an aberration in the breast tissue. So how do you approach that from a holistic standpoint?
In our medical office, I still have patients going to get their mammograms. There's some patients who do not want to have mammograms at all, and I've been able to have the good fortune to send them to alternative ways of diagnosing, such as thermography. But the mammogram is still our gold standard. I think the mammograms have gotten better. We have digital mammography, and there is less exposure with the digital mammography just because the picture is better. And so it can screen out a lot of the garbage, so you're not taking multiple images, or you're not taking as long. You're also able to develop those usually on the spot, so you can tell the patient and reassure her that her mammography is fine and let her go on her way. There are other methods of screening, but right now, breast MRI isn't used as a screen. It is reserved for those cases in which we're not able to see as much on the mammography, or if we have a question on the mammography, and that may actually keep someone from having a biopsy that they don't need. I have patients who have asked me about ultrasound, but when you think about some of the early detection that has been done on the mammography, I don't think that would be possible to see all of it on the ultrasound.
The technology,
and some of them are very, it depends. If you're doing a thermal image, and I think that would be more similar to thermography, I think you would have a better chance, but just the regular ultrasounds that we're offering on the breast, I don't think would be adequate.
Right. So, are you finding more and more women are refusing mammograms?
Yeah. That's coming up a lot in discussion.
Yeah.
But I also have talked to people, as I talked to you about some of the things that they can do that would be more protective for their breasts when they go for their mammogram. The foods that we talked about, the seaweed that you can eat with the iodine that may be more protective for your breast.
And what about the fact that once a breast tumor is detected by a mammogram, it's well known that the woman will have already had the tumor or breast disease for an average of 6 to 8 years. So that isn't really early detection, it's finding something after the fact, right?
Yeah, but when you think about it, also on some of these lumps or masses, you're not going to be able to feel. By the time that something like that, something that you've seen on mammography becomes palpable, it already probably has gotten to the point where it's spread quite a bit. And so in that way, right now, our advantage is being able to detect as early as we can.
Right.
And for massive screening, the mammography basically is what we have. We do encourage our patients to do self-breast exam. There was some controversy about that within the past 2 years, whether it was helpful, whether it caused more anxiety, whether people were really picking up anything on a breast exam, but I still think it's empowering for patients to understand how to do their breast exam and to do them, because a number of our patients pick up their own lesions. The majority of women are going to palpate it themselves.
Yeah.
And so I don't agree with having women not do self-breast exams after all these years.
Yeah.
You know, I think that it has served its purpose.
So 90% of women find the breast tumors themselves. So the breast massager, at least getting your hands on there every day, seems like it would be a common sense approach to tracking your own breast instead of just waiting from 1 year to the next to see if the doctor is going to find something.
Right, and you can't be squeamish about it.
Yeah.
I mean, I think that women are not really shown how to practice with it properly. In our office, we had started with young women. As soon as they're coming to us to talk about birth control, we were also teaching them how to do a self-breast exam and why they're doing it. They may not do it, but if we're repeating it every year, at some point they're going to find that they might pick that up and think that's important. But the other part of it is that I don't think we're teaching it enough.
Yeah. Yeah, so then the women should be asking their doctors to show them how to do it well, and then also to make sure that they're doing it correctly when they go in for their appointment.
Right, so I'm hoping that we're not getting too rushed in our offices. Many times when you go into an office now, there is a shorter amount of time that we're able to spend with the patient. And many of us are spending a lot of time trying to put information in the computer. And so all of that cuts down on face-to-face time and the practicality of being able to teach someone how to do a breast exam.
And the nurse
still
practitioners,
think it's important.
The nurses get continuing education units, so they, by learning, keeping up with the breast exam and so forth. So they might be good ones to tap into as well in your office, right?
Right.
Let's talk a little bit about hormone therapy and how you use that in your practice and if it can affect breast health in any way.
Okay. I do still prescribe hormone replacement therapy, but I do it in a different way, I think, than most of the physicians. As you know, we've had a lot of information thrown at us in the past 10 years with all the studies that were done about hormones. And many of the recommendations scared patients away from hormone replacement therapy. All of the studies that we have so far have primarily been on Premarin and a synthetic progestin. In this case, the biggest study was done with Premarin and Provera. And the Provera combined with the Premarin did cause an increase in the incidence of breast cancer. And so in that scenario, many people were turned away from hormone replacement or taken off cold turkey. We've had many of those patients come back to our offices and ask us for hormone replacement. In terms of the breast, estradiol and estrone, but primarily estradiol, is the estrogen that seems to be most closely linked with breast cancer. Your body makes 3 types of estrogen. It makes estriol, which is 80%, estradiol, which is 10%, and estrone, which is 10%. And there's a reason for that ratio. So when you're taking something like estradiol without having the balancing effect of having 80% of your estrogen be estriol, there is probably problems with both stimulation of the breast with the estradiol, and also at a time of life when women generally don't have high levels of estrogen on board. The estriol at this juncture has not been accepted or embraced by Western medicine. It's thought not to do anything. But what it does is it acts as a regulator for the other two estrogens to keep estrogen in check. And so the estriol primarily is the estrogen that you get when you eat foods that contain plant estrogen. And so it's not as strong. The byproducts of estriol are very stable. They don't do bad things to the cells in the breast. Estradiol and estrone break down to byproducts that really have to be moved out of the body quickly. They can cause some destabilization of the cells, of the DNA in the breast. And the estriol and progesterone, when you're going through your normal cycles, act in a protective way for the breast. In terms of estradiol, you want to make sure that you are doing enough things to balance or zero out the estradiol. And again, we talked about some of those foods that can help you to metabolize the estrogen and get it out of your system. In our office, we use a preparation of estrogen for hormone replacement called Triest that has all three of the estrogens in their correct ratio and is bioidentical for the body. So they really have a very short half-life. Your body uses it, recognizes it, and gets rid of it quickly. And I use that along with a natural progesterone, that works quite nicely. The progesterone helps with other hormonal balance in the body, including strengthening the adrenals and helping to maintain your bone mass.
Dawna, thank you so much for sharing your expertise as a holistic gynecologist and obstetrician. We've really appreciated your insights on the show.
Thank you.
Thank you for joining us on HealthWise Alternatives. We've been talking about breast health and, more importantly, holistic breast health. For HealthWise Alternatives, I'm Jackie Bell. This season on HealthWise Alternatives, we will be interviewing holistic medical doctors, practitioners, and counselors who will explain natural medicine approaches to health and disease. HealthWise Alternatives is created by The Woman in You and Take One Films. Check our website, thewomaninu.info, for scheduling information or contact your local cable access.